Veritably, they either have to, one, go to the bathroom or vomit, okay? If someone like this needs to vomit and they let you know that, or they're unconscious, you start to see them retch, you've got them well secured to the board, you tip the board, okay? So the vomitus comes out one side of their mouth and they don't aspirate. Yeah, you just actually tip the board, and if you have them well secured, they won't come off it.
C-spine is not the #1 priority. What is it? It's airway. Airway. Right. Then it's breathing. And then it's circulation. So all these things are secondary to having an open airway and then the ability to breathe. So if my breathing mechanism is okay and someone puts this towel in my mouth, you've included my airway. So that becomes precedent. So vomiting interferes with airway, and therefore airway has precedence over all the other things. Because without an airway, everything else is secondary because she wouldn't survive.
Once you've done your initial survey, you have to go back every 15 minutes minimum to recheck them because their condition can change. And that's where the paper and the pencil and the clipboard come in your first aid kit, to keep records of your ongoing assessments. You might have other people helping you, and they can read that because you've left it near the patient, and they'll know how you found them and what changes have occurred. Also, when you take them to medical care, you've got a good record for us to go by.
So really, I think you can swing from side to side. It wasn't just a nice healthy traction.
Was I heavy?
Yeah, your head's heavy.
I know. Well, I'll just try to pretend like I was just unconscious. Pretty heavy, huh? 1, 2, 3,
That was good. You guys got it. You're easy.
Get the eye contact, talk kind of quietly and softly the best you can, and that's it. Yeah, fine. Yeah, it hurts. I know it hurts. So we have to deal with that. You have to help me deal with it so I can help you. And just sitting there, a little hands-on, that makes no difference. If I've learned one thing, is that I don't care who you are. Superman, when kryptonite comes out, wants me to hold his hand. Okay? So if you start with Superman and work your way down to the rest of us, mere mortals, then it works. And just kind of focus. It takes some time. But others, are just out of sorts. And, okay, they're all okay with running around as long as they're not harming themselves or anyone else. Primary surveys. It's a hard concept. You can go around screaming and yelling. I like to calm him down, but I haven't gotten there yet. Primary survey. I try to focus on that in the back of my mind. If I have someone, can you talk with him, or take care of you, and you talk with him, and or come with me, help me. If they're not hurt, can you do this for me? Give them a simple task, and then have them aid you all the time. Occupy them from what their trauma is, mental trauma.
Usually you put it on the outside because then look this way, look, it can still bend. Okay, because then if you want to bring it around, you need to be able to do that. So you need it on the outside. No, because then it still won't bend. So right under, yeah, there we go. And here. Right, at the wrist. So say he has a fracture in here, you suspect it there, then. Okay, so we did the splitting part. Now we want to immobilize it so he doesn't move around. Or, say he has a free hand. If there was a lot of injured people, maybe he could apply direct pressure for someone, just because he has this. If this is his only injury, then he can actually get up and maybe help with an extra hand if you have a lot of victims. So you want to immobilize that so that if he does or needs to use the restroom or whatever, then.
And when you're assessing people in your neighborhood, you might know some of them and know what their medical problems are, but if you don't, ask them, okay? You might need to keep track of that. Someone who needs medications, and if they're available, if it's a diabetic, they need to eat on a regular basis, etc. So when you're doing your assessment, ask people what their medical history is, if they have any conditions that you should be aware of, and if they need any medications. Now, one of the real important things to do when you gather all this information on the victims in your area is to take all that information on the number of wounded and the kind of injuries to the nearest fire station. Okay? That's where you take it. This way they'll know what they have and what kind of resources they need to allocate to you. Okay, so that as soon as you've assessed everybody, primary and secondary, take that information to your nearest fire station, if it's still standing. And if it's not, then the next closest one. All right, let's do the test real quick. What's the first thing you check on in an injured person?
What about the pulse? I was just like, if they don't have
Airways first. That's the first thing, okay?
if they don't have any pulse.
But sometimes if you open their airway, you'll get a pulse once you get oxygen going. What are the two basic ways to control bleeding? And elevation. Right. How do you position a person suffering shock? Lie them flat, raise their legs. Right. Keep them warm. What's the most important treatment for a fracture? Right. Immobilize before you move. Otherwise you do more damage. What should be applied to burns? Right, dry clean dressing, and if it's a small area, you can put cool compresses on. No goo, no butter, no Vaseline, okay? List the two best ways to prevent spreading infection to yourself and others. Hand washing and a barrier, right. And be sure to do it in between people. And if you've got gloves, you still got to wash your hands, all right? Now, if you complete the course evaluations and hand them in on your way out, I want to thank you all for coming in on a Saturday morning.